Listeria monocytogenes. Okay, this is a gram-positive bacteria that its shape, I don't want to say pleomorphic. Remember, pleomorphic from back in our prokaryote chapter means that, there's no set shape. But this one, the shape will range from rod-like bacillus, shortened rod, cocobacillus, to long filaments. And this short rod to normal sized bacilli rod to long rod filamentous could be based on what nutrients are present in the broth that you're culturing it in, to age of the culture. What is it growing in? Is it growing in food? Is it growing in water? Is it growing in blank? What we do know, it's not fastidious. Remember, fastidious means it has to have set temperature, you know, set salinity, set pH. It has to have these extra things added to the agar or it will not grow. Now, Listeria monocytogenes, it's resistant to lower temperatures, higher temperatures, high salt, high pH, low pH. What we have found during infections is that Listeria monocytogenes will somehow get inside one of our cells. Okay, it's phagocytized, or some research is looking at whether or not it forces its own uptake. Once inside one of our cells, it's now protected from the immune system. One cell becomes 2, 4, 8, whatever, as it continues to grow, binary fusion. And then the bacteria will literally force their way out, propel their way out of that initial cell, and push their way into neighboring cells. So it literally spreads cell to cell, neighbor to neighbor to neighbor. For the most part, people are going to get infected with Listeria monocytogenes. It's either going to be mild or what they call subclinical. Okay. Oh, I got an upset tummy. Oh. Or, some slight fever, some diarrhea, maybe some sore throat going on. Oh, I shouldn't have ate that double cheeseburger at lunch. Oh, I shouldn't have ate Taco Bell. You know that feeling. But there are groups of people that this hits and it can be devastating. First group, people that are immunocompromised due to age, elderly, neonates. Think about it. An infant that's just born, the neonate, hasn't developed an immune system yet. Okay, they're in the process of developing an immune system. To develop a mature immune system means you have to be exposed to stuff. They haven't been exposed to anything really yet. Elderly, well, their bodies are wearing out. Okay, their immune system is going kaput because, well, their body's wearing down. Their body is shutting down, week by week, month by month. Immunocompromised people, because, well, immunocompromised. This could be people who are chemo patients, radiation patients, HIV patients, or AIDS patients. As the bacteria gets into their body, they've ingested it. It gets into a cell, invades another cell, spreads, invades, this cycle of invading. It will get into the bloodstream. It will get into tissues, get deeper into tissues of the gastrointestinal tract, the throat, the sinuses, nasopharynx, up into the sinuses, wherever, and it's going to settle out in the brain and the meninges. That septicemia means they are septic, means they have blood, or I'm sorry, bacteria, bacterial toxins, and all this other stuff floating around in their blood. Their blood is basically poison now. Death rate, once it starts to go to meningitis, is 20% for this group. Another group we have to worry about from a clinical standpoint, not that that patient themselves will suffer from meningitis and have a high mortality rate or anything, but pregnant women, while it's not going to be overly damaging to them, cause severe diseases in them for the most part, it can cross the placenta, become teterogenic to the developing fetus. So you'll end up with a failed pregnancy, fetal death, due to the bacteria invading cells, stem cells, pluripotent, omnipotent stem cells, and messing up the timing of tissue development in the developing fetus. Most cases are going to be dairy products, poultry, meat. Listeria monocytogenes is the reason why they now are telling pregnant women, watch out for hot dogs, cheeses, luncheon meats, ice cream, things like that. It's not going to be in all luncheon meats, all hot dogs, all ice creams, but there is the chance it could be there. Because remember, this one can tolerate the cold. The cold won't kill. The cold may slow down metabolism, but once it warms back up, because it's in your mouth, it's good to go. If you're trying to diagnose it, culture it. This is one of those you want to streak on a petri dish and put it in the fridge. The 4 degrees Celsius, 34-degree temperature of your fridge is perfect for the growth of Listeria monocytogenes. Other bacteria that may be present will not handle these cold temperatures. So you do the swab of the nose, of the throat. Streak, put the plate in the fridge, see what grows. If you've got good growth, well, pretty good chance that's Listeria monocytogenes. They also now have kits, ELISA, gene probe kits, so you can do a quick test. Quick here being, answers within an hour or two. Remember, quick is relative compared to, streak a plate, put it on in the fridge for 24 hours. If a patient presents with meningitis and you're taking the history, and you, the clinician, hear what their diet's been like, things like that. Here's their current medical history, and you immediately start pinging on Listeria monocytogenes, going to go with cocktail. Ampicillin with trimethoprim and God, I could never be a doctor. Sulfamethoxazole. And then once you get results back from ID lab, come in with erythromycin. This cocktail hits everything. Okay? Hits everything. Just in case there could be some resistance, just in case it's spread to an area that many of these other drugs may not be able to get into because of blood-brain barrier considerations. But you're going to hit it with a lot of stuff all at once and hopefully knock this out very quickly. Uh, Prevention, if you happen to be in one of those groups, pregnant woman, or your patient happens to be a pregnant woman, or somebody who's elderly, or potentially immunocompromised, tell them to watch what they eat, what they ingest. Make sure that what they're eating is truly pasteurized. Okay. Washing of the food, washing of their hands. Make sure they fully cook any and all foods. Don't go for deli meat. Stay away from the deli meats, things like that.